all the time. We're going to welcome in our next guest now. Dr. Margaret Glenn is joining us. She's a diagnostic radiologist, and we're talking about the MammoMarathon. Of course, this is Breast Cancer Awareness Month, and I appreciate the pink today.
Love it.
Oh,
Yeah.
thank you.
Yeah.
I always love pink.
Love
Very
it.
on brand.
Especially in October.
In the month of October. Talk a little bit about the importance of having a Breast Cancer Awareness Month and the importance of awareness and talking about it and getting folks in for those checkups.
As you probably know, and we hear so many statistics, 1 in 8 women will be affected by breast cancer in their lifetime. So screening has decreased morbidity and mortality exponentially since it started becoming more popular in the 80s. So getting your screening mammogram is absolutely essential, and getting it annually so that there is a comparison from the prior year so that you can see small changes, subtle changes, to be able to detect those cancers early, because early detection is absolutely key. And having a whole awareness month, it's not just about awareness and raising awareness about breast cancer, but also celebrating our survivors, celebrating those that are in the trenches right now, that are still going through it, but that are going to come out on the other side.
Yeah, exactly.
And supporting them. So that's the importance of October to me.
Absolutely. And as a woman nearing 40, I know that this is pretty important. 40 is kind of that magic number.
It is. So annually, we recommend for the woman at average risk of developing breast cancer that they get a screening mammogram with tomosynthesis annually. So
Each year. And so everybody's insurance differs a little bit, and sometimes you get different messaging, but it never hurts to do it every year. And we were talking earlier in the show, John was asking some questions and using the terminology, that it hurts. But I don't really like to say that, because you don't want to discourage anyone that has not done it. It's not that bad. It's a little uncomfortable. But my question is, why haven't they developed something that's a little better when it comes to the screening? Is that in the works?
I feel like we are constantly evolving in our technology. We do have a new paddle that we use for patients that have highly sensitive breast tissue or very sensitive to compression. We're not going to squeeze you in there. Our mammographers are not going to squeeze you in there so tight that you're so uncomfortable.
Right.
I don't even find them uncomfortable.
Yeah.
But other people have more sensitive breast tissue, and we try to understand that. So we do have a new paddle that's helping with that. Now we are able to synthesize 2D views off of the tomosynthesis. So it's not like you have to have a tomosynthesis and a 2D.
Right.
So that shortens the amount of time that you're in compression.
Right. And it's so important to just go with it, because you want to have the best picture, the best look. So you just do it. It's really not that big a deal, and it could save a life. I'm sure you're saving lives every day.
Every day.
So talk a little bit about the MammoMarathon. Where can women get a mammogram coming up here really soon at Hamot?
So UPMC has their imaging center in Sterling Square, and on Friday the 20th from 7 a.m. to 7 p.m. we are doing a MammoMarathon. That you can call and make an appointment. We also are accepting walk-ins. You will get a goodie bag. We will have cosmetology folks there, people doing manicures, pedicures. These are all complimentary things.
Nice.
Kind of like a spa day.
We have multiple gift baskets that we will raffle off. We have a face painting lady that's going to come do breast cancer tattoos, like the little tattoos. We have breakfast, lunch, and dinner being provided for people that come out to have their mammogram. There are multiple different vendors that are going to be there, whether to promote wellness or free giveaways or something to just spoil you. I think they have 5 people doing chair massages, so at different points throughout the day.
But circling back, do you have to be 40 to participate in this event?
So so you should be 40 unless you have a reason that you need a mammogram sooner, meaning that you have been dedicated as high risk.
And do you need a doctor's script to come in, or can you just come in?
No, if you're over the age of 40,
you just come on in.
You just provide your primary care physician's name.
And you can make an appointment, but you do take walk-ins as well.
That's correct.
Yes. Dr. Glenn, thank you so much for coming in today.
Thank you so much for having me.
Happy Breast Cancer Awareness Month.